Hey, Migrants with Migraines listeners. On the first part of episode 4, we have Brittany with us. She's a senior policy analyst at New Jersey Policy Perspective who will explain the Cover All Kids bill, what this bill is, and what happens next now that it has been signed by the governor. On the second part of this episode, I will reflect with Jazmin on our experience at the Senate when we gave a testimony in favor of the bill. Okay, so hi, Brittany. Thank you so much for being with us today. Uh, First of all, what do you do and how are you part of this movement that we have?
Hi, I'm thankful to be here. So thanks for having me. Like you said, I'm Brittany Holom-Trundy. I'm a senior policy analyst at New Jersey Policy Perspective, and we're an organization, nonprofit, nonpartisan research organization that works on policies that help low and middle income people in New Jersey and address equity and all sorts of issues. Trying to make sure that that our movements here have data showing how important they are and really moving forward policies that make a difference.
Yes. Oh, that sounds really interesting. And I know one of the policies, right, that you're working on is this Cover All Kids bill that was passed, I believe. And just for our audience, for those that don't know what the bill is about, in a few words, how do you summarize the bill? What are its goals?
Absolutely. So yes, my area of expertise is in healthcare, and so this is a health policy. It's a bill that focuses on the fact that we have over 80,000 uninsured children in New Jersey. I think it was almost reaching 90,000 in the past year. And so this bill is meant to address as many of the barriers as possible to make sure that all kids can get health insurance. So basically what it does is it eliminates waiting periods and premiums in the current CHIP program, NJ Family Care. And it also expands outreach, because there are kids who are currently eligible who are not enrolled. And it also creates a new coverage option, NJ Family Care Advantage, that is meant to provide an option for all the kids who aren't currently eligible for NJ Family Care. So this means regardless of immigration status or income, there will be an option for everybody. And so trying to make sure that all kids can get health insurance.
That's really awesome work that you're doing, and I think this bill is definitely very important. Especially, it's going to be very helpful to the immigrant community, right? Because there's a lot of parents that have children who they themselves can't afford going to the doctor, and so sometimes they have to choose between whether it's paying for rent or taking their children to the hospital, and I think that's something that no parent should have to go through, right?
Right,
Um,
right.
so I, from my understanding, right, the bill went to the hearing, it passed that, it went to the governor's office. I believe he signed it.
He did. He did.
Yes. So what does the future of the bill look like right now?
Yeah, so that's a great question, because the bill, I think a lot of people don't understand how a new program or things get implemented. That when these bills pass, it's not instantaneous always. So certain aspects of it, the elimination of premiums in the current program and the elimination of the waiting periods are instantaneous. So the premiums had already been eliminated during COVID and things like that. So that's already in place. And the outreach efforts, money is going toward that So that's going to happen as we go forward. The buy-in program, or, I say buy-in, I should specify though, that buy-in, the idea will be that our Department of Human Services will have a premium structure for it, but there will be a way with hardship waivers to get those premiums reduced or eliminated for people under certain conditions. And so the idea is that if your income falls below a certain level, you won't have to pay premiums. And that's what we're going to be monitoring and making sure happens. So basically what the Department of Human Services has to do now is create that program, the application and enrollment process. They have to create the plan. And so that takes about a year. So the DHS, as I call our Department of Human Services, indicated during the budget process that they were looking to expand coverage by July 1st, by next fiscal year. So that's July 1st, 2022. And so our organization, the NJ for Healthcare Coalition, the Consortium for Immigrant Children, all of us are going to be working over these next months to really make sure, keep track of what DHS is doing, make sure that the premium structure works. We're a little hesitant with the hardship waivers. That's a bit of a barrier, right? And so we're hoping there might be some way we can try to eliminate that for certain groups, right? To make sure that the hardship waiver doesn't become a hardship in and of itself. We want this to be as easy and accessible of a program as possible. So that's what we're going to be doing over the next several months. All of our groups are going to be, again, monitoring, talking with DHS, trying to make sure that everything really does get structured in a helpful way for everyone. So there's a lot of administrative background stuff that happens right now that people won't hear about, I think, a lot. But this is really the time that people can raise their voices, and either to organizations like ours and the Consortium for Immigrant Children and Citizen Action, all of these groups, and can be a part of the discussion and get into talks with DHS. And so then they'll create a program. And then by next July is the plan. They will open up enrollment. And in other states, there's been a pre-enrollment period and such. I'm not sure if that will happen here or not, but we'll definitely be keeping an eye out and trying to make sure that outreach efforts are getting to everybody. And keeping everyone updated, because I know it's a little bit hard sometimes with healthcare in particular. It gets so complex and people don't know what's going on. So trying to find ways to keep everyone updated. And so I think this podcast is great. I think that finding new ways to communicate with people and get information out about what's going on, where things are, what to expect is really important. So that this conversation is a great example of that.
To show what happens after the governor signs the bill, that there's so much that does need to happen in order for people to start applying. And I think this is great that we can have this conversation.
Yeah, just as another aside, one of the other things, besides just making sure outreach and information is going to get to everybody and that the application will be good for everyone, we want to make sure that the plan too is as quality, because the plan, as far as we saw it, our organization, the coalition, I think even DHS saw it this way going into it, is that this plan should be the equivalent of what's in NJ Family Care right now. In the past, if you know any history about buy-in options or things like that in New Jersey, in the past there have been issues where there have been some differences and such, and so we're going to be making sure it meets all the quality standards. It's exactly the same in value and quality and the same plan for everybody, because we don't want it to be any different. So that's what we're going to be focusing in on, all of our groups talking, working on this whole process.
Yeah, it definitely does take a lot of work, right?
Mhm.
Um, but it seems that the bill has gotten this far, and I think it really looks that it's going to help a lot of people soon.
Yes, yeah. I think I don't think I mentioned this. I think I mentioned that over 80,000 children are uninsured. But we also know, around 18,000 of those children are immigrant children who aren't um, don't qualify for various options right now. And so, yeah, I mean, it's going to help thousands of kids, and I think we know how important that is. I mean, we've known that for a long time, but I think COVID really brought this to everyone's attention that, the health of one New Jerseyan is really the health of all New Jerseyans, right?
Right.
Anyone who lives here. So,
Yeah. And that's one of the things that really makes me proud that I grew up in New Jersey. Right. I came from Mexico when I was 7. And so I've been here for quite some time already, 23. And for me, seeing that New Jersey wants to do this kind of, well, that that they really want to help children get health insurance, that makes me really proud.
yes.
And especially right when we talk about the children that are going to be covered, one of the topics that comes up a lot in our conversations with the youth group is about undocumented children and
Mhm.
whether the bill is going to cover them.
Mhm.
And I believe, when I went to the Senate to give a testimony, to give a testimony, there was some type of discussion about the wording of the bill, and that it didn't
Mhm.
really clearly state that it was going to cover undocumented children.
Right.
So, in your viewpoint, how is the bill right now currently worded so that it, children like who are like myself, since I'm formerly undocumented, could be covered?
Right. Yeah, that's a great question, because I know, as some people may know, there was a different bill beforehand, and then this new bill replaced it essentially as the all kids bill. So the first bill specifically stated, the expansion, applies to undocumented children, and this new bill is a little bit broader in its language. Essentially, what it's doing is it the buy-in program in the past has only been about income levels, in terms of, oh, if you don't qualify for NJ family care, if you're above a certain income level, we'll have an option for you of some sort. It was only looking at, children who were citizens above a certain income level. So basically what this bill did was it changed that and created the buy-in program so that it's any kids who are not eligible for NJ family care. And that's because of immigration status, because of income, any of those things, it opens it up. It, of course, is not as direct as we would have liked. Politics and healthcare gets unnecessarily politicized so often. It's very frustrating, because I think all of us in the coalition, for sure, see health as a human right, that any individual, any family in New Jersey, in the US, in the world, really should have access to the care they need, regardless. That each family, each individual should be able to um, have the opportunity to live the best life that they can. That leaves open choices about your life and how you do things, but you should have the opportunity, you should have the access, and that access, it shouldn't be defined by political or social barriers created through racism or sexism or any other discrimination, right? Everyone should have access to care. And so, to us, we would love for that language to be in our statute. And we were a little bit disappointed, of course, that it didn't specifically state that. And we're going to be working on that, of course. We're going to keep pushing forward and trying to get more explicit language in statute through, we can continue to pass bills, we can continue to build on this and get more explicit language in there. So what's great about this bill is that it sets that base. It uses some broad language that maybe we wanted more explicit, but it sets that base up, allows us the opportunity to open up eligibility. And, like I said, the Department of Human Services has explicitly testified that they plan to expand to undocumented children, expand that eligibility. So in many ways, it is out there explicitly. It just wasn't in this bill due to politics, I believe.
Yeah.
So, it's a difficult situation, and I'm not going to try to comment on the background of that or anything like that. But we would love to see an embracing of more explicit language in the future. But we're excited that this opportunity is there regardless, and that the expansion will happen. So yeah, I think it can be difficult to follow, though, for everyone who's trying to follow these things. When the language is kind of broad, it can be difficult to understand, follow. So that's why we hope to get the word out about the expansion and about what it's doing for everybody.
Yeah, and I really want to focus on that, what you mentioned about that it really does set up the base.
Mhm.
And I think that having like this start is very great. And just looking back, for example, a few years back, there was nothing like this.
Right.
And I think all the work that your organization has done and other organizations as well has led to this moment. And as you said, yeah, focusing on that excitement, I
Mm-hmm.
think this is definitely a great step in a great direction.
Mm-hmm. Yeah, we're really excited. I can't wait for July of next year. As we get closer, hearing more and seeing it really come together, and that moment of expansion is going to be wonderful.
Question that I have here is we as in our youth group, we've tried to, not only do we have the podcast, we also have Instagram posts that we do to communicate to our audiences of what's happening. What is one thing that we can do right from now till July to help in the efforts to get to July?
Yeah, that's a great question, because I think there's a lot of people who want to be able to help design these programs or make them work for everybody, but don't really know how. So right now, like I said, some of our organizations are going to be working directly with DHS, or in talks with DHS as they're designing these programs. And as we're going to, like I said, there's opportunities to introduce more bills and do things like that to try to keep improving things. So the best thing that everyone can do right now is communicate, either via social media, through organizations, volunteering. I know that we and the coalition, the healthcare, NJ for Healthcare Coalition, all of our groups are trying to reach out and get a sense of how do you get information, because we want to make sure everybody will be getting information. Lots of times there's language barriers, or programs will be created and they'll say yes, it exists, but they're, someone's only posting in a certain place and it's hard to figure out where to go find information about it. So helping all of us, our organizations, as well as the state, understand where you get your information, what kind of things you want to see in the program, what sort of barriers have existed for, application processes and things like that. And, you know, that communication, that information is very, very helpful, because that way all of these barriers can be addressed from the get-go, instead of implementing and then finding out people are having trouble with the application, right? Trying to get that built into the design would be great. So it, like I said, communicating via social media, through our organizations, even as an individual, reaching out to the governor's office, to legislators and things like that, and really advocating for needs is very helpful. And as well, just spreading the word can be very helpful, especially, like I said, language barriers are often an issue. As far as New Jersey bills, everything is, they're only in English, which means that some people may not even be able to get communication or information in a language that they really identify with, and understand all the details of. So I think finding ways to spread the information about this program, and sharing with friends and family. Lots of times people will trust friends and family, or other close individuals the most about healthcare. So just encouraging everyone to look into this, to consider it, to watch out for it in the news, and to know that this is a positive effort. I know that, especially with recent years, again, won't comment on all the details of it, but there's been a lot of hesitation to participate in programs, or fear that has been created through various rules and laws and things happening politically. And so what we really want to do is make sure everyone feels safe and happy with programs and interested in participating. And so really, like I said, communication is key. So I think back and forth, if I talk about friends and family, but even organizations like yours, like and your youth leaders and such, having listening sessions, doing all of these workshop things like that can really, really help going forward, because we need more voices. That's the short story of it, is that we really just need more voices in our health advocacy in New Jersey. So
I completely agree, right? It's about having these conversations with one another. And that's one thing in the youth group that I see a lot, is that some of the members, they ask themselves whether what they're doing is really having an impact. And I always try to tell them that what we do is communicate what is happening, not only communicate what's happening at the legislation level, but also what we as individuals are have gone through, and how that our stories could have been different. For example, we had initiatives such as these when we were growing up. So I think, as you mentioned, having these conversations and really explaining the in and outs of how even a legislation comes to be, I think these are great things to be talking about. Well, thank you so much, Brittany, for being with us today, and I really appreciate that you took some time to talk with us and really help our listeners understand what's happening with the Cover All Kids bill, and what happens after the governor signs it, and what we can do moving forward.
Absolutely. Thank you for having me again. This is excellent.
Hi, Jasmine. So thank you for speaking with me today. I just wanted to get your thoughts on how your experience was giving a testimony when you were advocating for the bill at the State House.
Yeah, hi. Thank you for having me. It was definitely an experience that I'll never forget. I think it was definitely a little scary at first because I'd never been in a setting such as this one. And the courthouse itself was very like, whoa, like everybody's here, the excitement leading up to it and, all the hard work that we put into, our speaking about our experience. I've never openly, spoke about my experience as an undocumented immigrant, but I thought that it would help out a lot of people. And I think that through my experience and what I was able to communicate with, the health committee, I think it definitely made a difference. And I think that, statistics and personal experiences are very different. It's easy to throw a number. It's very hard to sit there and listen to what somebody, felt and what they've been through. And I think it definitely impacted them to, move forward with helping undocumented children.
Yeah, I completely agree. And in your viewpoint, how did you see the room, like the vibe of the room of the people?
Mm.
You can be completely
Um,
honest.
it was definitely very like standoffish. Like I felt like it was a very like, and like we're here, let's just try to, just keep it moving type of attitude. So it made me a little like hesitant to, I was very like scared, I guess, to speak. But I guess in the end, we said what we had to say. I wish that we were given a final decision instead of like, hey, let's just wait it out and we'll pass it when that time comes, you know? It
Yeah,
would have been nice to get an answer in that moment.
exactly. Yeah, I think I also felt that way too. And sometimes I felt that they weren't even paying attention to what we were saying,
Mhm.
even though we were laying our hearts out there with our statements. So you know, the bill at the end, it passed and it was signed by the governor. So right now, um, in this podcast, the listeners will hear that there's a lot of steps that have to happen after the governor signs it in order to implement it, and for people,
Mhm.
I mean, for children to get the benefits of what we were advocating for. So, in your thoughts, how what would you like? What would you like to see in the upcoming months? Just in regards to, I guess, how would you yeah, I don't know.
Yeah. I feel like it's easy to say that they're gonna cover all children. I didn't see, that was our main thing, at least when we had a couple staff, speaking with them personally. I think I just want to make sure that they're gonna follow through on their word, and when they say all children, it's going to be all children, and undocumented children, I hope they're not left out of it because I've seen that, that's happened a lot. Um, so I think at this point, all there really is just hoping that they'll actually follow through, which is can be very difficult. But I do have faith in our lawmakers, and and I hope that you know, I really do hope that they are a part of the bill because it would be very disheartening to hear that they're not.
Yeah, and I think one of the just to 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 end like a conversation is one of the things that stood out right was the wording about the bill, about
Mm-hmm.
how it didn't really explicitly say that it would cover undocumented children, and that's something that we both wanted
Yeah.
really badly for it to say, because that's why we shared our stories, because it it would have helped us a lot growing up. So I think that if we if as you said, like I think I would also agree that I just want them to actually do what they what the bill we hope that it does, right?
Yeah,
To help these children.
I agree. And I mean, if worst comes to worst, where they're not going to follow through on their word, myself and all of us advocates, I'm ready to be very vocal about the fact that they did not introduce that. And I'm sure that we have a lot of immigrant advocates that are ready to make a lot of noise and be very vocal about the fact that those children are not in that bill. So
Exactly. Well,
yeah.
thank you for sharing your experiences with us, and yeah, it was great having you.
Thank you guys.
That's all for this episode, Migrants with Migrants listeners. And to summarize, we learned that one, the goal of the Cover All Kids Bill is to expand access to health insurance for all children in New Jersey. One of the ways the bill is doing this is by doing the New Jersey Family Care Advantage, which would be an option for children that are undocumented. Two, in the next few months, the focus of the advocating community will be on monitoring the Department of Health and Services to structure the program in an accessible way for everyone and to make sure that it is ready for enrollment by next July. And lastly, Jazmin and I echo the shared sentiment in the immigrant community that we hope that lawmakers do include undocumented children in the bill and that as advocates, we are prepared to make a lot of noise if they are not included. Hi, listeners. The resource for today's episode is Instagram. If you're like me, you probably didn't know that if you're going through a difficult time, you could just type in the search box keywords such as depression, and you will be referred to multiple resources.